All right, so accommodation. One of the things that accommodation is not, as far as what we're not assessing and what we're not using, is it is not using a light source. And that may be a little confusing to some people because a lot of times we would use a pin light for accommodation, for the assessment of accommodation, but the light should not be on. So there should not be a light at all when we're assessing for accommodation. The other thing that sometimes accommodation is confused for is looking for the person's eyes to cross. So when you have a person's eyes cross, that's typically assessing for convergence, the ability of a person's pupils and eyes to kind of converge by coming together to look at a point. So you should not be using a light source when you're checking for accommodation, and you should not be assessing for their eyes to cross. It's not eye crossing or convergence. So what is accommodation? Accommodation is assessing for a person's pupils to enlarge when an object is far away. Okay? So when you're looking at a person's pupil, as you hold an object a little bit further away, their pupil should be larger. And then the other thing accommodation is the ability of someone's eyes to constrict, and we're really talking again about the pupils, to constrict when an object is close. All right, so what do I mean by this? You heard me say that a lot of times we use a pin light, but the pin light should not be on, because once you turn on the light, you're no longer assessing for accommodation. You're still assessing the reaction to the light. So what you want to do is, if you're going to use a pin light, you need the pin light to be turned off. You can use a regular pin. So when you're holding the object out in front of your patients, you are assessing their pupil. And so as you look at their pupil with the object far away, as you bring the object in closer, their pupil should constrict to accommodate for the fact that the object is close and their pupil doesn't need to be as large. Then, as you pull the object away, you should see their pupils dilating and enlarging to accommodate for the fact that the object is moving further away and their pupils should get larger. So I hope that I've helped that make sense. It is just a common mistake that I saw and a common misunderstanding, especially in mistaken charting, when people would chart that the people had PERRLA, but they used a light for the accommodation. So that was a mistake. And then also just not understanding that accommodation does not use a light source at all. So I hope that made sense. Let me know in the comments.